Hi, good evening, all. Welcome to this test and discussion session on the quiz that we had conducted for this week. We'll try to solve all the questions that were asked during this week. So let's get started straight away. The first question was regarding the type of elbow joint, right? What type of joint is elbow joint? So let's try to solve this question. The elbow joint is an example for which type of synovial joint? As we know, elbow joint is made up of two types of articulation, right? One is the humero-radial, right? And the other one is humero-ulnar, right? These are the two joint components which are put together, they form the elbow joint. Now, the humero-ulnar joint is an example for hinge joint. The humero-radial joint is an example for pivot type of joint. So when we choose the elbow joint as a whole, right, the answer that we usually pick is hinge joint, right? So elbow joint is an example for complex hinge joint. So complete definition or complete type, if we call, this is a complex hinge joint, right? So remember, humero-radial articulation is pivot type, right? Now, this is the actual answer. Now, what about the other option? For example, when we talk about the ball and socket type of joint, what are the joints we have? We have the shoulder joint, then we have the hip joint, and then we have the incudostapedial joint. You will learn about this joint when we dissect the head and neck region, right? The incudostapedial joint, which is present between the ear ossicles, right? The incus and the stapes. What about pivot joint, right? The best example for pivot joint is superior radioulnar joint. Okay, so we have the superior radioulnar joint, we have the median atlanto-axial joint, right? The joint between the first cervical vertebra and the second cervical vertebra, which helps in doing this movement. What is it? The movement of no. So we also refer it to as the joint of no. Done. So this is an example for the pivot joint. What about saddle joint? Now the best example for saddle joint in upper limb is the first carpo-metacarpal joint, right? Now this is very often asked even in your exam. What type of joint is the first carpo-metacarpal joint? So this could come as an MCQ, right? Done. So let's move on to the next question. The next question is, a patient presents with fracture of surgical neck of the humerus. Which nerve is most likely to be injured? Straightforward question. If it is surgical neck, it is axillary nerve, right? Now, if we just draw the nerves related to humerus, let's imagine we have the head of the humerus, right? So we have the shaft and then we have the lower end, right? The nerve that is related to the surgical neck. Then there will be a a nerve related to the shaft of the humerus, and then there will be a nerve related to medial epicondyle. So what are these nerves? So surgical neck, axillary nerve, right? So this is related to surgical neck. What about this? This is the radial nerve related to shaft, right? To be more specific, we call it as radial groove, or we also call it as the spiral groove, right? Now, what about this nerve? This is the ulnar nerve, right? This is related to the medial epicondyle. Now remember, medial epicondyle, when you hit against a hard surface, you have that strange tingling sensation running down the medial aspect of your forearm, right? This is because of direct stimulation of ulnar nerve. Got it? So this is regarding the question related to fracture of surgical neck. And remember, if the axillary nerve, so let's mark the answer. The answer is axillary nerve. If axillary nerve is damaged, it can lead to paralysis of deltoid, and it can also lead to a peculiar abnormality where cutaneous sensation is lost. So if we just write down both, so one is loss of abduction of arm, right? And this is because of paralysis of deltoid. Whereas the second important clinical uh, effect is regimental badge anesthesia, right? It's called as regimental badge anesthesia. Done. So this is regarding fracture of surgical neck of humerus. Done. So nerves related to humerus is a very important MCQ topic for your exams, as well as once you start writing your entrance exam, even then it becomes important. Okay, so this question was about nerves related to humerus. Right. Let's move on to the next question. Which muscle is responsible for initial 15 degrees of abduction, right, of shoulder joint? Okay. Now remember, when we talk about abduction of the shoulder joint, right? So abduction of shoulder joint, we have 0 to 15, right? 15 to 90, and more than 90, which is also called as overhead abduction. Okay. So what are the muscles which are responsible for this? Remember, 0 to 15 degree, it is believed to be by supraspinatus, even though this is challenged in recent textbooks, right? But still, if a question is asked regarding which muscle is the initiator of abduction, please go with supraspinatus. Then 15 to 90 degree is the prime abductor, which we just discussed. It is the deltoid. And more than 90, remember, it is serratus anterior as well as trapezius. Okay, this is also the favorite question for your practical examiners. Okay, abduction of the shoulder. What muscles bring about abduction of the shoulder? Done. So what is the correct answer here? The correct answer here is initiator of abduction is the supraspinatus. Okay, deltoid is the prime abductor. Infraspinatus forms the muzzle of the rotator cuff, as well as it's one of the lateral rotator of the arm. Serratus anterior, of course, pushing and punching movements is the primary action, and then it brings about overhead abduction. Done? Are we clear? Right. So this is regarding abduction of the shoulder joint. Now, the next question is, which vein is located in the cubital fossa and is most commonly used for venipuncture? So if we just draw the outline of the cubital fossa, we have two veins running. Let's imagine this is the radial side. This is the ulnar side. So here we have the cephalic vein. Here we have the basilic vein, right? So let's imagine this is the basilic vein. And what is this? This is the cephalic vein, right? Now connecting the two across the cubital fossa is our, what vein will be this? This is our median cubital vein. Okay. Now, why do we use median cubital vein commonly for venipuncture or drawing the venous blood? Remember, two reasons. One is the median cubital vein is connected with the deep veins by perforators. Second thing, the median cubital vein is well supported by bicipital aponeurosis. Right? So because of easy access, and it does not slip during venesection because of two reasons. One is perforators. The second one is it is supported well by bicipital aponeurosis. So because of this, it is the commonly used peripheral vein for venesection. Done. So what is the correct answer here? The correct answer is median cubital vein. Done? Right. Now, the next thing is with respect to brachial plexus. The question is straightforward. Brachial plexus is formed by which anterior primary rami? And it is pretty simple, C5 to T1. If we draw the outline of brachial plexus, we have C5, this is C6, we have C7, we have C8, and we have T1. The C5 and C6 roots, they will unite, and let's imagine they will form the upper trunk. The C7 root will continue as the middle trunk. The C8 and T1 root will unite to form the lower trunk, right? Each trunk will divide into anterior division and posterior division. So let's draw the anterior division in blue color, right? And let's draw the posterior division in the red color. Okay, so this is the posterior division. This is the posterior division. So all posterior division will unite and this will form what? This will form the posterior cord. So all posterior division will unite to form posterior cord. What about the anterior division of upper trunk and middle trunk? The anterior division of upper and middle trunk will fuse, right? C5, C6, C7. And what will this continue as? This will continue as the lateral cord. Done. Now, what is the fate of the anterior division of the lower trunk? This will continue as what? This will continue as the medial cord, right? So lateral cord will have three branches, right? Which is remembered by LML. Lateral pectoral nerve, musculocutaneous nerve, lateral root of median nerve. The medial cord gives off five branches, right? And we use one mnemonic for this. Most medical men use morphine. Most medical men use morphine. I'm sorry, medial pectoral nerve, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, ulnar nerve, and median nerve. Right? Medial root of median nerve. So this is regarding the branches from median cord. What about posterior cord? Posterior cord will also give five branches, which can be remembered as ultra. Right? Upper subscapular, lower subscapular, thoracodorsal, radial, and axillary. Are we clear? So this is regarding the entire brachial plexus. So what is the answer here? C5 to T1 nerve roots. Done. Again, brachial plexus will be a very important topic. It's an important long essay. It's an important short essay. It's an important MCQ question for your exam. Right? Done. Next question. Wrist drop is characteristic sign of injury to which nerve? You don't have to think twice before answering this. What is the nerve? The nerve is radial nerve. Fine. So what is wrist drop? Wrist drop refers to loss of extension of the wrist, right? So if this is the anatomical position, this is called as extension of the wrist. If we cannot do it, this is called as wrist drop. So what is wrist drop? This is loss of extension of the wrist. And why is this due to? This is due to paralysis of the extensors of the wrist. And what are the paralysis? I'm sorry, what are the extensors of the wrist? All these are the back of the forearm muscles, right? So these are muscles of back of the forearm. Done. So all these muscles of back of the forearm is supplied by the radial nerve, either directly or indirectly. Now, when I say directly, remember the brachioradialis, extensor carpi radialis, longus, and then supinator, right? Not supinator, it's anconeus. So these three muscles are innervated directly by the radial nerve, whereas all other extensor muscles, you take any other extensor muscle of the forearm, right? Out of the 12 muscles we have, all these are supplied by posterior interosseous nerve, which is the other name given to deep branch of radial nerve. Done? Right. Okay. So remember, wrist drop again will be a very important topic for your exam. Okay. Saturday night palsy, fracture of the the spiral groove or radial groove or shaft of the humerus. All this can lead to wrist drop. Done. The next question. Which of the following is not a muscle? Okay. Now you need to highlight this. Not a muscle of the rotator cuff. Okay. As we know, rotator cuff is formed by 6 muscles, which is commonly written like this. Okay. So we have the supraspinatus, we have the infraspinatus. Small t here refers to teres minor and S refers to subscapularis. Okay. Now this is what I want you to remember. Remember it as sits, and in that, remember it as small t. Small t stands for what? Teres minor. Done. So what is the correct answer here? Which of the following is not a muscle of the rotator cuff? It is teres major. What about teres major? For teres major, remember this. Lady between two majors. Okay. If you are talking about the humerus, right? So if you are talking about the humerus will have, let's say, a medial lip and a lateral lip. So the medial lip is teres major, the lateral lip is pectoralis major, and in between the two, we have the latissimus dorsi, right? This is what we mean by lady between two majors. So teres major gets inserted where? It gets inserted to the medial lip of bicipital groove or intertubercular sulcus. Done? Right. The next question. Blood pressure is routinely measured by placing the cuff around the arm to compress which artery? So when we measure the blood pressure, we tie the cuff around the arm. So which is the artery of the arm that is getting compressed here? Again, a straightforward question. It is the brachial artery, right? Brachial artery, as we know, is the continuation of the axillary artery, terminates by dividing into radial and ulnar artery at the level of neck of the radius. Fine. So these are 2 points I want you to remember. For example, let's imagine we have the outline of the arm, and let's imagine here we have the cubital fossa, right? So we have the axillary artery, right? The axillary artery will continue as the brachial artery, right? The brachial artery at the level of neck of the radius will divide into two. So what is this level? This is lower border of teres major. So this is axillary artery. This is the brachial artery. This is the radial artery. This is the ulnar artery. And what is this level? This is the neck of radius. Now this extent will be very important for your exam. From where to where the brachial artery extends? It extends from the lower border of teres major to the neck of the radius. This is what we need to remember. Done? Are we clear? So this is the 8th question. Done. Now let's talk about the 9th one. Here we are talking about the carpal tunnel syndrome, and as soon as we see the name, carpal tunnel syndrome is caused due to compression of which nerve? It is the median nerve. How? Remember, we have the carpal bones, right? Now these carpal bones, right, they give rise to formation of a tunnel called as carpal tunnel, right? This is by the flexor retinaculum, right? So flexor retinaculum converts the space between the retinaculum and the carpal bones into a tunnel, and in this tunnel we will have four muscles. I'm sorry, four tendons, each of two muscles, flexor digitorum superficialis and profundus, and in between you will have a nerve, and that nerve is the median nerve, right? What is this? Flexor digitorum superficialis. And what about this? This is flexor digitorum profundus. So median nerve is the nerve that can get compressed in carpal tunnel syndrome. Carpal tunnel syndrome usually presents with tingling sensation over the lateral 3.5 digits of the hand, right? This is carpal tunnel syndrome. So what is the nerve involved in carpal tunnel syndrome? It is the compression of the median nerve. Ulnar nerve passes superficial to flexor retinaculum. It does not pass deep to it. Done? Right. The last question which was asked in this week's quiz was, what is the primary action of the lumbrical. So let's dissect each option. What about flexion of fingers at distal interphalangeal joint? At distal interphalangeal joint, it is flexor digitorum profundus. If it is proximal interphalangeal joint, it is flexor digitorum superficialis and flexor digitorum profundus. Then, abduction of the fingers, dab. What do I mean by this? Dorsal interossi abduct. What about adduction? Remember it as pad. Palmar interossi. What do? They adduct. So what is the last option that is left? Flexion at metacarpophalangeal joint and extension at interphalangeal joint. This is the typical action of the lumbricals, right? So what they do, if we consider this as the metacarpophalangeal joint, they flex the metacarpophalangeal joint and they extend the rest of the interphalangeal joints. So this is actually the position of or action of the lumbricals. Flexion occurring at metacarpophalangeal joint, extension occurring at interphalangeal joint, right? This is the primary action of the lumbricals. Okay, remember nerve supply of the lumbricals. The lateral two lumbricals. Okay, the first lumbrical and the second lumbrical are innervated by the median nerve. Third and the fourth lumbrical or the medial two lumbricals are innervated by ulnar nerve. All palmar interossi, all dorsal interossi are supplied by ulnar nerve, isn't it? So this is what we need to know. Remember, so what is the concept that is getting tested here? The nerves of the hand as well as the muscles of the hand. So you must know thoroughly all 20 intrinsic muscles of the hand. Don't worry too much about individual attachments. Learn attachments as a group and then remember their innervation as well as remember their actions. Done. So this is a quick revision of the questions that we had asked over this week's anatomy quiz, right? We will come back with one more round of quiz for next week and we will discuss the questions related to these quiz again next week. So let's get connected next week again. Thank you very much.
Thank you, sir.